In order for muscles to produce movement, they must attach into bone and cross joints. Muscle attachments must be learnt in detail for all muscles. The attachments are divided into the proximal attachment, which is often called the origin, and is usually the closest point to the axial skeleton. It's also the point of most stability. The distal attachment, on the other hand, is usually the point furthest from the axial skeleton and is the point of greatest movement. In the case of biceps, as we see here, the proximal attachment is up here at the shoulder girdle, whilst the distal attachment is down here at the radius. During its action, during a typical action of biceps, what we see is the movement of elbow flexion, so the shoulder stays stable whilst the radius and ulna are moved proximally towards the humerus. Many muscles will cross more than one joint, and muscles will produce movement at each joint it crosses. As we see with biceps, as I said, the proximal attachment is up here at the shoulder girdle, so therefore it crosses the shoulder joint. It crosses the elbow joint, and it also crosses the radioulnar joint, so it will have an action at the shoulder, the elbow, and the radioulnar joint. Anatomically, muscles are classified according to their shape and the orientation of their fibres. Parallel muscles are muscles that have their fibres organised parallel to their line of action, or almost parallel to their line of action. They are then subclassified according to their shape, as we see here: quadrilateral muscles, strap with tendinous intersections; triangular, spiral over here; fusiform muscle, where we have a bulbous central portion condensing to two tendons; or a multi-headed muscle, in this case a tricipital muscle. It can be a bicipital muscle or a quadricipital muscle. The benefit of parallel fibres is that they provide a contraction over a large range of motion. The problem with parallel muscles is because of their attachment, we are limited as to the number of fibres we can place within that muscle. In the case of this quadrilateral muscle, we can only provide attachments here and attachments down here. So therefore the muscle will always have limited strength. Pennated muscles, on the other hand, have an increased surface area for attachment. Here we have a unipennate muscle, this is a bipennate muscle, and over here we have a multipennate muscle. The role of pennation is to increase the force that a muscle is capable of generating. So therefore pennated muscles are much stronger than parallel muscles. They do this by having an increased surface area for attachment by the inclusion of intermuscular septa, or aponeuroses. Here in this multipennate muscle we can see 4 proximal intermuscular septa and 3 distal intermuscular septa. The fibres are then organised in this feather-like appearance, this pennated appearance, so we have a greater surface area for proximal attachment and a greater surface area for distal attachment. That leads to more muscle fibres and therefore more force being generated by the muscle itself. Skeletal muscles are under neurogenic control. That means that we can consciously stimulate these muscles, and stimulation leads to the contraction of individual fibres. And depending on how many fibres within a muscle we stimulate, we can graduate our force accordingly. If the force produced by a muscle is equal to the external force, as is the example in this first diagram here, if the force produced by biceps equals the weight that is being held in the hand, no movement will be produced at the relevant joint, and therefore we will end up with a contraction, a muscle contraction known as an isometric contraction. If the force generated by the muscle is greater than the external force, what we'll see approximation of the proximal and distal attachment. The distal attachment gets pulled up towards the proximal attachment, the muscle itself shortens whilst contracting, and this is known as a concentric contraction. However, Sometimes we can have the external force being greater than the internal force generated by the muscle. In this case, the muscle is still contracting, it's still in a state of contraction. This time, proximal attachment is remaining stable, but the distal attachment is moving away from the proximal attachment. For example, this individual here will be lowering the weight down towards gravity. That is known as an eccentric contraction or an eccentric contraction. In all three cases, the muscle is being controlled by the central nervous system, and the amount of force generated is determined by the number of muscle fibers being fired.